Do you ever wonder if the lifestyle choices you make have an impact on your future health? And why some people can lead an unhealthy life without becoming ill, while others smoke for a few years and get lung cancer? A new test called suPAR can give you an indication as to how your body reacts to your lifestyle and guide you towards a better future. These and many other topics were discussed during the second International suPAR Symposium in Copenhagen, Denmark during March 2011.
Yeah, well, it's a brand new thing, sort of, with the offering of the prognostic value compared to the diagnostic tools that we already have available, like CRP and BCT, and that's the benefit over the competition.
I mean, it's amazing that a marker that comes out of HIV field and cancer now shows also a value for predicting cardiovascular disease. And then we have seen how it's a good prognostic marker in infectious diseases. It's not a diagnostic marker, but it's a very good prognostic marker. I think suPAR might be helpful because it kind of seems to reflect an overall addition of all these biological processes that all in themselves lead to disease. And this may then be this immune stress that means that some cells start dividing, turning them into cancer or plaques, and all these processes. That inflammation, because the cells are not concentrating on fixing things that are going on in the body. And that's what I believe is inflammation, but it's a mixture of many things.
Could somebody of us, actually sort of elaborate even further the very question that you posed there, that do we actually know currently what suPAR actually reflects?
I think there's a lot of different biological mechanisms within the body that all add to suPAR. It doesn't reflect one single thing. Immune activation, cells are activated, they upregulate uPAR. We had a discussion yesterday with Dr. Ostrowski and Nicola Sidenius, and they are very, where does it come from? And Caesar believes that it's the endothelium that actually adds a lot of suPAR. Then when cells are migrating, they also use the uPAR receptor. So the more activated, the more migration, and the more and it correlates, we've seen in several of these studies, it correlates with TNF-alpha, IL-1 beta, CRP, acute phase reactants. So all these, what do you call it, immunological stress, we call it inflammation. It is a marker of some kind of systemic immune activation within the body.
Is suPAR a prognostic or a diagnostic measurement?
Well, I can start out. I think that we have seen numerous of studies showing that as a diagnostic tool, it's not the best. It's an unspecific molecule rising in a variety of diseases and conditions. So I think as a diagnostic tool, it doesn't work. However, there are some data showing that as a prognostic marker, it can be a good value adding something on the top of others.
I assume that the major use will be in the big diseases where there's also a market for even marginal improvements in diagnosis and prognosis.
And if you see the distribution in different subgroups, you can see here very nicely that women has higher levels. Even if it's a very short age range between 63 and 68, you can see if I divide the population in above or below 65, those are older, they have higher levels. Smoker compares to non-smokers, so the smokers have very higher levels. And diabetics compared to non-diabetics, it's not really significant, but they have higher levels. And cases, here it is, the cardiovascular disease has higher level compares to those without any. So in the conclusion in my study is that the increases with age and higher in women and smoker and diabetics, it's significant correlated with CRP, white blood cell count, but not LPPLA2. And that's elevated levels of suPAR are associated with an increased risk of cardiovascular disease in an older subject and all-cause mortality independent of traditional risk factors.
One might claim that what we have in our hands is really sort of risk recognition or overall risk signal, which could really supply us with the signal of this particular patient.
we did find that suPAR had significant association with subcutaneous organ damage in the general population, and this association was independent of traditional risk factors as well as high sensitivity CRP. And finally, suPAR was independently associated with the cardiovascular events, which could reflect that they might have an independent role in atherosclerotic pathogenesis.
Well, I can see that it's separated from controls throughout my study in Crohn's disease patients, and I really believe it's going to be a good marker in the future.
The aim of this study was to determine whether plasma levels of suPAR could be used as a marker of premature death in the middle-aged and elderly individuals. We found a significantly higher mortality rate in the highest suPAR quartile compared to the three lower quartiles, approximately 27% in the highest and 10% mortality in the lowest quartiles. In conclusion, we found that after adjustment for conventional risk factors and inflammatory markers, plasma levels of suPAR strongly predicted mortality in the middle-aged and elderly Danes.
So we made a model, a cumulative incidence model of respiratory cancer among current smokers. We divided the smokers into sex and age-specific suPAR quartiles, since we know that suPAR is higher in women than men, and suPAR increased with age. And as we've seen in the other studies presented here, it's pretty dangerous to be in the fourth quartile.
What could be my imagine was that we have a guy with a BMI of 35 who was still carrying the remote control in his hands and visiting the GP and asked him, well, can I still be sitting in my sofa visiting the television and do nothing to engage in physical activity, stop smoking? And maybe in the future we will know whether the core can use suPAR to tell this person, just keep sitting there because your suPAR is very low. But if his suPAR was intermediate or high, he would probably make a prescription for activity, physical activity, and some other efforts to have this guy losing weight and so on. We don't know yet, but that could be a future perspective, and we'll see whether we can handle that in the future.
So I think if we look at where we could use suPAR today, I think at least I have got the impression that we definitely see a high use in the preventive care, the preventive medicine. I also see that the delta value is getting more and more interesting. So if you, as a healthy person, know your suPAR level, and then later on become sick, and then you follow the suPAR levels through the sickness, you get a much more accurate read and understanding what is going on with your sickness.
Over the last decade, suPAR has proven to be a marker of inflammation. Most recently, it has demonstrated its value as a health marker amongst the general population. Conclusions presented here clearly show that an elevated suPAR level is a marker of an unfavorable prognosis, possibly due to an unhealthy lifestyle. So the question remains, can you live the life you're living? The suPAR test could give you the answer.